Hey everyone, and welcome to this week's COVID-19 office hours. My name is Natalie Matthews, and I am just going to spend a brief moment going over some housekeeping reminders and logistics before we turn things over to today's team. So hopefully everyone is hearing me just fine right now through their audio connection, but if at any point you have any challenges with the audio connection, we do encourage you to switch over to the call-in audio. That tends to work a little bit better. And to find that number, I'm going to just go ahead and type it in the chat box for everyone right now. We are recording today's webinar, and a copy of that recording along with the slides from today, as well as the content from the question and answer and the chat boxes will all be posted to the HUD Exchange. Just give us a couple business days and we'll get those up there for you. In terms of connecting with us during the webinar, we do hope to hear from everyone throughout, but we won't be hearing from you via audio. So we ask you instead to go ahead and use the chat feature that you should see up there on your screen right now. If you look in WebEx, you should see several different icons kind of towards the bottom middle of your screen. One of them over to the right will look just like a chat box. Go ahead and open that. And when you're sending in those messages in the chat box, make sure that you are selecting everyone. It should default to that for you, but if it doesn't, just go ahead and click on the Q bar and you should be able to select everyone. And with that, I'm going to turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs.
Thank you so much, Natalie. And we have a little lighter agenda today than we have in the past, so we'll probably finish sooner than our usual 60 to 90 minutes, but we will have some people from the SNAP's office on the line. You can see some of their names listed on this slide here. We have a couple people from our field offices, including Taylor Keeley and Aaron Weaver. We have some of our TA providers here to help answer questions, including David Canavan. And moving on to the next slide, we have our regular Centers for Disease Control and Prevention update from Lindsay Branco. And we also have Barbara DePietro available from the National Healthcare for the Homeless Council to help answer questions, and Dina Hoosier from the Department of Veterans Affairs. So I want to thank all our presenters and our resources for joining us today. And with that, I'm going to turn things over to Lindsay to give our CDC update. Lindsay?
Yeah, thanks, Norm. Next slide. For our, oops, this might be last week's slide. So this graph, we're actually up to 7.9 million total cases in the U.S. now, with an increase of almost 60,000 in the past 7 days. So we're currently at 216,000 deaths. So this is as of 10/15, sorry. So we are continuing to see a very sharp increase in the rate of cases. So it's more important than ever to really work closely with your public health partners, make sure you're following your infection control and prevention procedures in your facilities, and making sure to remind staff and clients of the COVID-19 prevention measures, including social distancing, masks, and hand washing. I did also want to just remind folks that CDC has released some guidance around holidays that are coming up and family gatherings. As we know, they are actually turning out to be a substantial source of spread. So I have a couple links that I'll put in the chat, just talking about some considerations for Halloween, for Thanksgiving, for just general family gatherings to share with your staff and clients as appropriate, just so they're aware of how their activities outside of work or outside of their houses can increase their risk for COVID-19. Excuse me, and that's all I have, Norm.
Thank you so much, Lindsay. Definitely appreciate the update and the new resources for people. So with that, we're going to introduce a couple new technical assistance resources we have available, specifically around planning for winter shelter. We know this is a topic that a lot of people are very interested in, and so we wanted to present you with some of the resources here. I will say these resources are not quite yet posted to our website. We do expect to have them posted by the end of this week, but we did want to share them with you and talk through and answer some of your questions in the meantime. So with that, I'm going to turn things over to Marlisa Grogan from the SNAP's office, and she's going to walk us through the resources. Marlisa?
Okay, thanks, Norm. Hi, everybody. If we could just go back one slide, I wanted to take a second just to orient everyone to the number of resources that sort of comprise the winter planning toolkit, I guess you could call it. So we're providing a winter planning overview because we know that a lot of people are focused on this, and this is not to say that, you know, everyone should just stop and sort of like change trajectory in the midst of your coronavirus response, but more that you should, we know that you all are thinking about winter planning, and this winter planning guide is meant to help guide you through the planning process in light of all of the efforts that are ongoing when it comes to COVID response. So we have a winter planning guide overview document that sort of sets the context, and then it introduces a number of different materials. One is a winter emergency planning template. So that's something that continuums of care can actually use to facilitate their planning with local partners. And that document also has a creative staffing solutions appendix that gives you some tips about how to just think through winter planning and staffing those winter shelter options. There's another document that goes through alternative approaches to winter sheltering, which I'm going to go through in a little bit more detail in a second, as well as some checklists for shelter facilities and a winter response activation and communications plan. Next slide, please. So the reason, the need, I think, that many recipients and continuums of care have raised is that you all are facing really complex challenges, and you know, I think now more so than ever before, communities are really weighing profound risks and can't just you know, go on with winter planning in a more informal way as in the past, but that COVID is just such an immediate risk and immediate consideration. So on one hand, you have the need to save lives, which requires bringing people inside from the cold. And so if that's not done with infection control measures in place, there's a definite increased risk of COVID transmission. So that leaves out many traditional winter sheltering sites that are just not available, not viable options. And the beds that are being lost due to physical distancing, as well as the increases in unsheltered homelessness, can really lead to greater winter shelter capacity needs. More beds, more space, so that's a definite need. And then alternative sheltering sites, they need to be equipped to mitigate for the spread of COVID-19. Next slide, please. So the tools that we developed are really geared towards supporting you all, supporting communities to design a winter emergency response that really takes all of those considerations into account. And we narrowed the focus to these important steps: engaging critical partners, designing a winter plan to meet cold weather sheltering needs, and putting infection control measures in place to keep everyone safe and minimize the risk of spread within winter shelter sites. So going into a little bit more detail about the first area, engaging critical partners, the idea is to extend the reach and effectiveness of winter emergency response, and making sure that, you know, that continuums of care aren't planning, that shelter providers aren't planning in silos, that the people at the table are representative of the racial makeup of the population served by the homeless system. that you're including people with lived experience, and that you're also bringing the right partners to the table. Next slide, please. So with these really complex challenges, it's not enough for provider by provider taking this on themselves, or even just continuums on their own, but it really needs to be a cross-section of strong collaborators. So we have this matrix that identifies the key partners that really need to be at the table involved with this planning process, and including them at the beginning of winter planning will allow communities to leverage expertise and experience to the fullest. And it's really critical that your government partners specifically with public health and emergency management to make sure you're aware of the new risks in winter planning this year, and that COVID considerations are taken into account. So the partners are identified here: public health, healthcare for the homeless partners, emergency management, people with lived experience, outreach providers, behavioral health, and then we've identified key roles that they can fulfill in the planning process. Next slide, please. So the actual winter planning template that we've developed is framed in this way. There's a baseline project need, which we're calling Plan A. If there's a marginal surge within your community, you can look at it as a Plan B approach, and then Plan C, responding to a substantial surge. And the reason why it's not a straightforward, here's the plan, go forth, it's because it's really hard to predict the level of shelter demand. We go into the data points that you can look at to get a better idea of whether you're going to need to plan for Plan A, Plan B, or Plan C. But just given the current circumstances, we're recommending that you adopt a contingency planning approach so that you can be flexible, you can adapt based on the level of infection that your community is encountering. And the template is also there to help you, and it's designed in a way so that your strategy can be really versatile and it can adapt as necessary. So baseline needs can be projected by looking at, these are some of the data points you could look at. You can take a look at past trends in winter shelter utilization, also combined with loss of beds due to physical distancing and shelter decompression. You could look at projected increases in unsheltered homelessness that you may be able to expect within your community, and as well as like real-time increases in shelter utilization. So this is the type of framework that's described in the winter planning template that can be used to drive collaboration between the homeless system leaders, the key stakeholders that we just went over before, such as emergency management and public health. And then COC you can actually use this planning process itself as a way to facilitate engagement and draw on the completed plan to make the case for the need for additional resources and investments. So including people in those relevant partners in the planning process is a way to really convince them, we're talking about this and you know that this is a need as well as we do. So then you can see the marginal surge and the substantial surge is the differences are really in the amount of resources and the amount of involvement needed by key partners. Next slide, please. So this is a snapshot of the template. You can see how it guides communities through each function of the winter planning response, and it's and then again split up between Plan A for River, the projected need, Plan B with a marginal surge, and Plan C for a substantial surge. And then it goes through it prompts you to identify resources that are needed across these Plan A, Plan B, Plan C scenarios of escalating winter shelter needs. And then communities can use this tool to facilitate the conversations and make sure that you're covering all the necessary areas of the planning process. Next slide, please. So that snapshot just showed the framework, and the sections that are actually covered are facilities, where you're identifying alternative sheltering sites, staffing, transportation, personal protective equipment, how to quantify the needs, how to work with emergency management to identify those sources, and the roles and responsibilities for each, along with the communications plan. Next slide, please. So the companion resources that I mentioned before include the alternative approaches to winter sheltering, which I'll go into a little bit more detail about in a second, the creative staffing solutions, which just gives some ideas for how you can think about bolstering, ramping up your staff. And then there's a link to a personal protective equipment burn rate calculator, as well as a template to facilitate your winter response activation and communications plan. Next slide, please. So alternative approaches to winter sheltering, this is on the left, it's a snapshot of what that document looks like. And then this document itself goes through facilities and spaces to consider, attributes of the space, programmatic considerations, COVID-19 considerations, and funding considerations when it comes to winter sheltering options. This is also sort of like contingent on the capacity and resources available at the community level. There's a good approach, a better approach, and a best practices approach based on what's available and feasible within the community. But when it comes to facilities and spaces to consider, we go through the types of spaces, which ranges from repurposing public spaces like a rec center to all the way to a best practice approach such as using hotels or motels as non-congregate sheltering. Attributes of the space, we describe a range from the basics like, the space will protect you from inclement weather to a best practice approach, which would just be more involved, such as providing access to individual bedrooms and bathrooms. The programmatic considerations range from like a good approach, such as, basic needs are being met, all the way to a best practice approach, which gives you considerations like being able to provide housing-focused case management and assistance with housing search and placement. And then COVID considerations, we describe infection control measures at the very basic level, which would include social distancing, and enforcing policies requiring face masks, having a process to refer folks to testing, all the way to a best practice approach, which would accomplish, the basics, in addition to implementing a system screening process and then a process to be able to prioritize people experiencing homelessness for non-congregate shelter or isolation quarantine based on their high-risk factors. And then funding considerations, which I will go over now on the next slide. So we've received a lot of questions about what really constitutes temporary emergency shelter under the ESG program and what kind of temporary emergency shelters would be adequate, especially in the context of winter planning, as well as, what's just eligible. What can you use ESG CV funding for to be able to fund temporary emergency shelter? So we went into a little bit more detail than what was, explicitly identified in the notice, and you can see that the top is going to be a little bit more familiar. In general, when a structure is unable to meet habitability requirements for emergency shelter, then a structure or a portion of a structure could be eligible for temporary emergency shelter. So the first check is really, is this structure, this project that we have in mind, is it going to meet habitability? And if the answer is no, then that's the point at which you would consider, maybe we should think about temporary emergency shelter. So then the thought is, what is the purpose? If it's used for a response to a natural disaster or public health emergency, namely COVID, and the local public health official determines that temporary emergency shelter is necessary for your community's coronavirus response, and this is only intended for use for the period of time needed for coronavirus response, so it's necessary for coronavirus response, and it's going to be time limited to January 31st, 2022, unless HUD grants an exception. So just to fine-tune that last point, it's going to be time limited to January 31st, 2022 for the Esgcd funds that are applicable to the notice limitations, but otherwise it's the September 30th, 2022 time limit. And then getting to the actual criteria of the structure itself, the characteristics, it must meet a person's very basic needs, including protection from inclement weather, so that means cover on all sides and overhead. It's going to provide a space for each individual to sleep and rest, which would include sleeping accommodations like a mat, cot, bed, 4 structures that provide overnight shelter. So if this is meant to be sheltering people overnight, then they need to have a place to be able to rest and sleep. And then access to sanitary facilities for hygiene and toileting. So if those criteria are met, then it's likely that that structure would be eligible for Esgcd funding. Next slide, please. And then the final focus of the winter sheltering tools is preventing the spread of COVID-19. So providers, public health authorities, COCs, emergency management, it's a partnership effort, and everyone must work collaboratively to be compliant with COVID-19 mitigation measures all across the winter sheltering sites that are activated. And the 3 strategies that are necessary to be able to do this include physical distancing, wearing masks, and then enhanced cleaning and disinfection. Next slide, please. And then finally, to be able to help with that, we have preparedness checklists for shelters that were developed in partnership with the CDC. These checklists should be shared with all shelter providers. Continuum of care leadership should reinforce the importance of keeping these health and safety standards in place, and they cover topics ranging from physical distancing, face coverings, ventilation, safe sleeping protocols, through meal management and testing. So they go through specific considerations to make sure that all necessary infection control measures are being put in place and adhered to. So we hope to get these out next week, and as always, if you have questions about the materials or if there's something that hasn't been covered, please feel free to reach out to us, and you can always submit an AAQ as well. And that's all I have.
Thank you so much, Marlisa. I want to follow up really quickly because we had a few questions related to emergency shelter versus temporary emergency shelter. And so one of them had to do with when a public health official, sort of their determination that it's necessary, when is that required? And then another one had to do with which ones have to have to adhere to habitability standards. So can you sort of combine those questions into like the matrix of what's required where?
Sure. So, you would first consider whether or not a structure can meet habitability, and if it can meet habitability, you can consider it an emergency shelter. And if you're just doing an emergency shelter activity, it's more of just like the plain vanilla what you typically would do, like shelter operations. If you're funding it under the emergency shelter component for ESG, then it needs to meet habitability. You need to meet the environmental review requirements, and the public health official's designation is not necessary. So you would not need to, it's always a good idea to involve public health, but you don't need any sort of documentation from public health saying that the emergency shelter activity is necessary. So if you're thinking about implementing a project involving structures that will not meet habitability, that's the point at which you would consider doing a temporary emergency shelter activity. And then that activity would not need to meet habitability. It would not need to meet environmental review. You would not need to complete an environmental review, but you would need to involve public health, and public health would need to designate that temporary emergency shelter activity is necessary for your community's coronavirus response.
Great. And what would count as documentation from that public health official? Like, what are we looking for them to include in the file there?
So we would not expect that a public health official would go out and do a physical inspection and take a look at each individual structure or anything of that sort. It would be a higher level documentation. It would be an important thing or a good idea to describe. So have in your documentation a description of the project. If it described the structure itself, the temporary emergency shelter structure itself, whether it's a sprung structure, whether it's like a tuff shed, and we have some other examples in the shelter attributes document. But then you would want to say portable bathrooms will be available for it's accessible to those who are staying in the temporary emergency shelter. So you'd want to hit on the major criteria that we're looking for, so that we know, there's cover on all sides, on the roof. There's access to sanitary facilities. There's space for sleeping. If you have mats or a cot. If it's hooked up to electricity. So you want to be able to put enough detail in there so that when the public health official signs off, they've got a good idea of what you're doing. And then the public health official would say, yes, this is necessary for our community's coronavirus response. And then the more detail that they're able to provide, like we have a lack of shelter beds. Any kind of data that you could include would just be a bonus, but it's sort of at a project level. That's the level of documentation that we're looking to see.
Great, thank you so much. And we have a lot of questions coming in, so we're just going to dive into things. So one of the questions we had, and Ebony, I wonder if you could take this one. It's about, if a state health department will not do universal testing in a shelter if someone tests positive, can ESG funds be used to pay for universal testing within that shelter?
Street outreach can be used for, we allow it to be used for coordinated medical care, so that includes testing for COVID-19.
So they could use it. And then, Lindsay, I want to ask you about, So in those cases, like, does that make sense as a practice? So if a state is not providing universal testing, if someone has tested positive within a shelter, I mean, how should our stakeholders here think about that? Should they be looking at using alternative funds to do a universal testing program, or what would you recommend there?
I mean, ideally, they're able to coordinate with either the local health department or the state health department. So I would, I don't know that it would want to be the first line of defense, but I know that different states and local health departments have different levels of resources. So it's a hard question to answer as a whole, but I think, it's an option if you're kind of hitting a wall in terms of talking with the local and state health department, but I would make sure, even if that's the case, that you're still coordinating with them very closely, because they're going to need to, know what the results of all those testing events are, et cetera.
Great. Thank you very much. We have a couple questions that I wanted to bring in that we've had from past calls that we didn't get a chance to answer before. So I'm going to direct, I think I'm going to direct this first one to Brett. Does the 12-month limit on rental assistance in the Esgcd notice, does that also apply to services that are funded under rapid rehousing or homelessness prevention?
No, it only applies to the rental assistance. So services can still go for up to 24 months.
Okay, and so Marlisa, we have a question about the September 30th mega waiver. Do recipients need to notify, if recipients were using one of the waivers that expired on September 30th and they want to continue using that waiver, do they need to notify their field office the way they did previously? Do they need to again notify their field office that they plan to use the waiver?
Yes, recipients do need to notify their field office again, even if they're continuing to use a waiver that they already notified their field office about. I mean, just to add to that a little bit, though, there may be a gap in timing because of when the former mega waiver expired, and then taking that into account along with the 2-day time period between the notification to the field office, being able to use the waiver, and just the timing of the third mega waiver, we know that it's going to be really tight. And so there's also likely to be a gap between when one waiver expired and the other, you make the notification and are able to use the subsequent waiver. So we just want to say get your notification in as soon as you possibly can. But we're aware of this, and when it comes time to monitoring, we're taking this into account, this tight timeline, and we'll be cognizant of that for monitoring purposes.
Great, thank you. I have another question, Marlisa, about plan amendments. So I'm just going to read the question out. So the question says, our 2019 plan amendment was approved prior to September 1st. We did not state in that that we would use Esgcd funds for street outreach, but now we want to use a small portion of the funds for that purpose. To do this, will they require another amendment? And would this change the approval date for all of the other activities? And I think the issue here is, does this affect which of the requirements in the September 1st notice apply? So first question, do they need an additional plan amendment if they want to sort of create a new outreach activity?
Yes. If you haven't included a component or, an ESG activity that you would like to carry out, you would definitely need to amend your action plan. And, it would be a substantial amendment or not, just depending on how you've defined a substantial amendment in your citizen participation plan. I think, it's substantial enough, this change of adding an additional activity is substantial enough that it's likely to be a substantial amendment. But the notice limitations are only applicable to the specific activity that you would have added after September 1st, on or after September 1st. So if it's a street outreach activity, then it would only be that activity which is is subject to the limitations, and there really aren't any, that are specific to street outreach. But like if you were to have added a rapid rehousing or an emergency shelter activity after September 1st, on or after September 1st, then it would only be those activities themselves that are applicable to the limitations, and the limitations would not be retroactively applied to the other activities that were already in the plan that was reviewed by the field office prior to September 1st.
Great, thank you very much. We have a question, and Brett, I wonder if you could take this one. We had a question earlier about identification and whether, as part of the eligibility determination for homelessness prevention or rapid rehousing, what is required as far as ID documentation? Do they have to have a government-issued ID? I know you answered it in the chat, or somebody answered in the chat. Can you talk about what the answer is?
Yep. For HUD's purposes, and when we come out to monitor, we'll only look to see that the person or the household met the definition of homelessness or at risk of homelessness. We don't require any identifications like birth certificates or social security numbers or government IDs as part of determining eligibility for ESG assistance.
Great, thank you. And just also want to add that we also really strongly believe that ID should not be a barrier for people getting prevention or rapid rehousing assistance. So we'd encourage people to be careful about adding additional requirements. In some cases, you're not allowed to add additional requirements to receive Esgcd assistance, but just want to be sure that people sort of recognize the purpose of the program is to house people and keep people housed and protect them from homelessness. And so any barriers we can remove to accomplishing that goal is really helpful. So thank you for that, Brett. We have a question about procurement standards. I think, Marlisa, you've been working on this. Can you talk about, has HUD released any information on procurement requirements or how people should handle procurement with respect to Esgcd activities?
We do have one that's in the works, but it hasn't been released yet. It's pretty close to being finalized. But just in general, it's the alternative requirement that gives recipients, not subrecipients, just recipients, the ability to deviate from federal procurement requirements. That doesn't mean that you don't need procurement requirements at all. Like, you need to develop written processes that you intend to follow as an alternative to the federal requirements, and then documentation about how you're carrying that out and how you're protecting against fraud, waste, and abuse is critically important to protect you from any sort of audit findings. So the guidance that we hope to post will give you just some ideas of alternative approaches that you can consider in developing your own process if you decide not to follow the federal procurement requirements.
Great, thank you. So we have a question about whether the income limits for Esgcd have been released. So I think the question is related to the fact that very low income is determined on a fiscal year basis, and so I think there's new data that comes out October 1st, and it's obviously past October 1st. I don't actually know if those have been released. We will try to find the link to those if they're available and get them out to people. Great question, though. Thank you for that. We have Another question here. Brett, I wonder if you can take this one. If a staff member at an emergency shelter needs to isolate because of COVID symptoms, can ESG funds pay for a hotel room, for example, until they get test results? Do we have an answer to that question?
Yeah, I think that we can. I'm confirming with Marlisa, but I think that we said that yes, that would be considered an overhead cost of whatever activity they're carrying out. Is that right, Marlisa?
Yes, that's right.
Great. So we have a question about the mega waiver here. Marlisa, I wonder if you can take this one. Is the FMR waiver going to be continued for ESG and not just for COC?
So we did not include the ESG FMR waiver because it's included in the ESG CV notice. So it is continued, but just through the notice as opposed to the third mega waiver.
Great, thank you so much. So it's as if it was in the mega waiver.
That's right.
Yep.
So it's for any, I'm going to just clarify, it's for any ESG annual funds as well that are used to prevent, prepare for, and respond to coronavirus, which is probably most of yours right now.
Great. Thank you very much. We did have a couple questions about the PIT count and the COC NOFA and the YHTP NOFA that came up in the chat. I'm just going to do a very quick rundown of the answers to those. On the PIT count, we do not have any additional guidance yet. We were trying to get some out by today, likely next week. We are exploring a lot of different options around the unsheltered count. We're trying to make something as simple as possible, as safe as possible. We know that people are both incredibly stretched because of CARES Act funding, because of COVID, and just, I mean, the work is just generally hard to do, and that safety is obviously a huge and important concern. So we are trying to come up with something that meets all those challenges, but also we need to know something about people who are experiencing unsheltered homelessness and whether that's going up or down. So we're trying to come up with something that sort of meets all those characteristics or requirements. So again, hope to have information soon. I know we're cutting into your planning time, and I apologize for that. On the COC funding process, we do not have an update on the COC funding process. We're still looking for a non-competitive process. We can't move forward on something like that at this point because you need the kind of thing you need legal authority to do. And then on the YHTP NOFA, I can't talk about the NOFA, but I can tell you it's going to come out soon. My guess is within the next week or two. So please stay tuned and please apply. I know many of you have applied in the past. I'd really strongly encourage you to apply again. And if you haven't applied in the past, also encourage you to go ahead and apply. So thank you for all those. We had a question. I'm going to sort of throw this over to Marlisa. Actually, I'm going to throw this over to Lisa because you put some resources in the chat window. But we had a question about, Lisa, about resources or guidance for shelters and housing programs on emotional support animals. Can you talk about anything we have available on that? Sorry, Lisa, you may be muted.
Can you guys hear me now? I'm sorry.
Yep, I can hear you loud and clear. Yep.
Okay, good. Yeah, so it was a great question we got from Carrie, and Brett put in the chat. I'll go ahead and post it again, but there's a resource on the Fair Housing page that talks about how to serve folks with emotional support animals. But I will just say, everyone on this call knows that all of our programs are low barrier and we're screening folks in. So if folks are eligible for your program and they have an emotional support animal, the expectation, of course, is that we accommodate them and serve them. But to Carrie's point, she was just looking for some guidance about how to do that. So there's a great resource that the Office of Fair Housing has published, and I will repost that in the chat for folks.
Great, thank you so much. Let's see, I think those are all the questions we have that I feel like we have answers to. We have some questions about renters insurance, and I think we may want to sort of, actually, maybe it looks like we're able to answer some of the questions on renters insurance. So I don't remember who answered this, but Marlisa, maybe you can tell us the answer. So is renters insurance eligible for ESG funding? And then there's a follow-up question after that.
Okay, so renters insurance in most cases will not be eligible because it has to be a fee that's attributed to all all tenants across the board, and so we wouldn't consider renters insurance a fee, and even if the landlord requires it of everyone. So it's a benefit that goes directly to the tenant, so it would not be an eligible cost.
And then if there are fees that are related to that apartments charge or rental agencies charge for people who don't have renters insurance, I honestly had never heard of that, but is that something that you could pay for? So that might be a case of a fee that is like widely sort of charged to tenants. Is that something that would be eligible?
That is a good question. So I think that we may need more details to have an idea about whether that specifically is applied to everyone in the same way. I think the fees that we traditionally say are eligible would be like a move-in fee, or if there's like a maintenance fee, like a garbage pickup fee, something along those lines that everyone has to pay. I think it would be best to submit an AAQ about a fee that's assessed if someone can't provide renters insurance. That's an interesting one that we've never encountered before.
Great. Thank you so much. So I think those are the questions like we can answer at this point. So I want to thank everyone for joining the call. I want to thank Marlisa for that great rundown of the winter shelter activities. Again, we will have those posted very soon. I did want to say a very special thanks to Lindsay and all her coworkers at the CDC. You guys have been fantastic throughout this whole process, and I shudder to think where we would be without you all. I just wanted to really thank you for working with us, for paying extra special attention to people experiencing homelessness, and for just, these cannot be easy times to be doing your job, and you just are professional and do incredible work. So thank you so much. Also want to thank our TA providers that sort of keep these office hours going, but also are producing incredibly great documents to help people get through everything, and also are providing and available to provide technical assistance to everybody. Seriously, if you have a question or you need help with something, please reach out. We want to be helpful. Our technical assistance providers are really, really good. And lastly, I want to thank you all for joining again today and asking great questions, and just, again, continuing to do all this work under incredibly challenging circumstances. We are, in the SNAP's office, are big admirers of yours, and just are astounded that you do this day in, day out. So thank you so much. Hope everyone enjoys the rest of your day and the rest of, and I hope you have a nice weekend. And that is the end of our webinar. Thank you.